I'm with His Royal Highness Prince Hassan of Jordan, who is there in Amman. I'm very grateful, Your Royal Highness, for you to take part in the COVID-19 Chronicles and to launch this series beyond the UK. You have experienced a multitude of crises in the Middle East and beyond in the last few decades with great experience. I'm just wondering where you think COVID-19 fits in. Is it unique, or are there lessons from the past that can help us navigate what we're going through at the present?
Well, may I introduce my remarks by expressing my deepest condolences and sympathy and prayers for all those who have been affected, either directly by losing loved ones or indirectly by suffering themselves, and in particular, the elderly and children now who are being exposed to this pandemic. And I want to start by quoting the European Council of Foreign Relations, who say very clearly that if the public debate plays up the perceived link between the virus, borders, and migrants, this will become dangerously close to arguments about national parity and, of course, racial superiority. And I'm afraid that rather than accelerating the impulse of serving human dignity, it's accelerating these impulses. And I think I've mentioned to you in the past that territoriality, identity, and migration, I believe firmly, are the three challenges that the world has faced since the World War, since 1945. So, in the words of Time magazine, this would not be a 21st century crisis if refugees did not manage to get the most screwed, forgive me, at the end. So this might be the one thing that COVID has not upended, and that is, ironically, the lack of care for those who are marginalized and those who are vulnerable. And on the contrary, I think that subjectively speaking, and even objectively, I mean, I as a Muslim represent a deep concern and abiding concern with the fact that up to 80% of the world's refugees are Muslims, and they are outside the social safety net of most governments. Were it not, in fact, for United Nations organizations, they would not be surviving the terrible conditions that they are besieged by in Yemen, which has been the largest humanitarian crisis in the world. And need I mention Rohingya and Syria and Libya and elsewhere. But I'm reminded of 1967 when I was building refugee camps. And when I asked why were we building refugee camps on water reservoirs, water basins, the answer was, this would be temporary. So how temporary is temporary? I mean, you may choose to go to war, but war on COVID is not something that any of us chose. On the contrary, it chose us without discrimination across the world in the 5 continents. And I think that this institutionalizing of war has taken too much of our effort and financial outlay. I think it's A.C. Gray who brilliantly outlays in his book, War, entitled War, the military-industrial complex warning of Eisenhower in 1958-59 came too late. The old general was trying to tell people that after 2 world wars, truly world wars, we should effectively consider human dignity as opposed to materialism. And this is the war that we face today, a war of the confrontation between materialism and between a focus on human dignity, whether individual or, as the Swedes would like to call it, the herd mentality. Human beings should count first and foremost.
So you've offered us some examples in recent history, and you're right, I completely agree about this issue of using war imagery. That has been a feature of our response to COVID-19. And the fact that the people who will ultimately be affected most of all are the poor, the vulnerable, the refugee. Is there another side to it? Because in my conversations, I have heard people talking about new understandings of community, a new understanding of interconnectedness. And you hinted at it when you talked about the fact the virus knows no borders. It knows no borders of ethnicity, of religion, of gender, of nationality. So is that something that might develop and that actually we might build on in terms of the interconnectedness of humanity?
It was Cromwell who said, when the enemy is hopeless and scattered, who will answer to the misery, suffering, the ruin, the bloodshed? And if our conflict is also between working together or working individually, and if bilateral arrangements are being regarded in terms of their efficacy, that is to say, China and South Korea and Japan trying to prove that they are more effective in addressing the health requirements of North Korea, then we're on to a new race, not an arms race, or the rat race as it used to be called. In addition to that, we are suffering from the efficacy race in trying to run after crises. So my question basically to myself and to you and to those concerned in crisis management is that in 1965, I received a study from Humboldt saying you in your part of the world simply have to look first and foremost at prevention. Prevention is better than cure. And unfortunately, I have experienced maybe one war every decade since that time. And prevention, whether of armed conflict or of the loss of human dignity in terms of poor education, poor health, and the absence of a non-discriminatory process of concern for others in terms of cultural affinity, this has not taken place in our Levant region, for example, on a non-discriminatory basis. I mean, yes, some countries are cooperating and war makes strange bedfellows in terms of health, but this is the diktat of the moment. What is going to happen in years to come? So when they speak of the multicultural approach, I just hope that regions will be given a chance to express themselves rather than what we know today of East and West. That is to say, East is Moscow, West is Washington, and everywhere between Havana, Tokyo, Belgrade, Paris, Cairo, Beijing, and Johannesburg is derivatively located. So I wonder about polarity versus plurality. Religion is based on diversity and respect for the other. If our problem is going to cease to be a problem with the other, with the pandemic, or with other nationalities, or with competitors for cures, then I think that we are headed not in terms of solidarity and resilience towards promoting shared values, but rather towards a partisan approach, which is decelerating on the one side our altruism and accelerating history in the worst possible sense.
And what we're seeing, of course, is a huge amount of partisanship in terms, as you say, the competition for the vaccine, to have it first because I deserve it first. And the tragedy of that is that it feels so old-fashioned. It feels yesteryear. And what the virus is doing today we are in the cure situation. We are no longer in the prevention situation. We can no longer prevent it. So is there something that we can do that can take the cure beyond the specific and adapt it to the universal? Or am I being Pollyanna-ish? I mean, you've devoted your life to dialogue, to engaging with communities in the Middle East, faith communities around the world. And is this a moment where we can actually say, this is it now, guys, this is it, because we've talked about this before. Unless there is this genuine partnership, unless we escape the race for victory, this race for superiority, we are all doomed. Aren't we at that moment, without being eschatological, but aren't we at that?
I genuinely hope so, because I was speaking to Mrs. Sirleaf after her brilliant handling of Ebola. She said, well, this was a localized issue. And today she is saying, you know, it is no longer MERS and SARS and COVID alone. It is the question of everyone's health. What Charles Taylor talks of in terms of deep diversity, the plurality of ways of belonging and being. But if we speak of lives on the one side and livelihoods on the other, then unfortunately the banality of the material rat race has crept in. So I don't think that it is possible to be connected, comprehensive, or primal in terms of change less, but rather nonetheless real, if we do not understand that the centrality of human dignity is the centrality of our construct of the law of peace. As we know, the humanitarian law is largely concessions from the law of war, and consequently is taken seriously by specialized organizations such as the Red Cross. But in terms of religions, I would assume that we all share in the value of the four tenets of the Holy Quran, which are, of course, justice, benevolence, wisdom, and compassion. So how do we institutionalize compassion? How do we institutionalize justice outside the blame game of are you democratic or are you not democratic? There has to be a basic platform on which justice is understood not to be in the context of health, education, and welfare, the domain of specified agencies, but rather to look at the broad challenges facing the human being. But if we are going to talk of the total number of deaths, bankruptcies, layoffs, suicides, mental health problems, losses to GDPs and investments alone, I would just like to say that a part of the world is talking about the financial repercussions of one crisis after another, while the other part of the world is talking about, as in my country, the trilemma. Yes, how do you balance the budget? But how do you attend to refugee requirements? 1/4 of our population is refugees. And in addition to that, how do you attend to the real needs of your population? So I think that the suggestion that we can work together in this coming period is a suggestion of can we revisit the Helsinki process, where you have North and South as part of the process. And in that context, I see a hardening of borders. So we see the world through plague eyes now, through the prism of borders, rather than through the prism of a call for a humanitarian order.
Your Royal Highness, thank you very much.